Very good afternoon. This is a case report where we doctors turned detective. I'm Dr. Pallavi Prabhu. There was, this case practically blew us out of our minds. Every step, diagnosis, treatment, and management kept changing. And none of us were sure about the diagnosis or the etiology, and a lot of difference of opinion between the consultants were there. It was nothing short but a Pandora's box. A normal 48-year-old female walks into our OPD. She had mild watering, photophobia, and itching with blurring of vision. And she did have a history of allergic conjunctivitis on and off, which she was treated. And keeping into all the general and systemic examinations where normal ocular examination yielded a early cataract was there with a grade 2 papillary changes. And everything appeared okay. So keeping all this clinical picture and everything into mind, from our first diagnosis came into picture, that was the allergic conjunctivitis. We treated her with the same treatment. And day 2, she was subjectively better. So we advised to continue the same. Now day 4, lo behold, she walked in. Look at that, there was worsening of symptoms. She had very severe photophobia. She was not even able to open the eye. There was no discharge, no corneal infiltration was seen. And with difficulty, when we opened the eye, she had a very large epithelial defect and there was little DM folds. So immediately we stopped the steroids, put a bandage contact lens, started her on antibiotics and topical lubricants, and we started her on homemade eye drops. And now our second diagnosis kicked in, where it was an epithelial defect, the cause was not known. Now day 5, now this patient turned up and she had a profuse purulent discharge, severe congestion. Out of concern, we were wondered whether she was putting the drops. We checked all the drops. To our surprise, the homemade eye drops which she was putting had white precipitates and was very turbid. And again, we doctors, we all went into huddle. We didn't understand what was happening. No clue at all. Okay, chalo, we decided. We removed the bandage contact lens. We decided to go in for culture and sensitivity grams and QH. And we changed to a different brand and a different batch. And we thought we should be seeing this case every day. We were still clueless. We didn't know what was happening. Now, the third diagnosis kicked in. That was the bacterial keratoconjunctivitis. On day 6, patient progressively worsened. Now the AC reaction was there with a small hypopyon, and the digital pressure went up. Again, a lot of huddle between the glaucoma retina department, not cooperative, patient was not opening her eyes. And again, we thought we will start with a fortified cefazolin, amikacin with oral acetazolamide. Instead of homemade, we put atropine. The day 7 to 8, she was status quo. And on day 9, surprisingly, the lab results came back. It was an E. coli, gram-negative bacillus. And the biggest challenge, how did the gut bacteria get into the eye? And that too for a normal female. And of course, sensitivity, whatever we were putting drops, it was very sensitive. So on day 12, slowly the cornea was healing. AC was little shallow. Fibrin reaction had reduced. And we thought we'll continue with the same treatment and keep watching. Status quo also on day 14. On days 16 and 19, she was much better, but there was now a persistent non-healing epithelial defect. She had, again, the digital pressure was okay. Now we thought like probably she's healing, but because of all the drugs which we have pushed into her eye, there was a lot of toxic keratouveitis. We should stop all the medication, put her on more lubricant, put her on plain chloramphenicol. And yes, we were still not convinced, but we went ahead. We asked her to take a higher center opinion, and she refused. And we insisted on an opinion. Now we had a non-healing epithelial defect with secondary glaucoma due to drug toxicity. On day 21, when she went to a higher center, the doctor there, she turned detective. She got an immediate pH test, which was done on both the drops. She got a fresh bottle and the patient's bottle, and surprisingly, the fresh bottle had a pH value of 7 and the patient's bottle had a pH value of 11. And immediately we had that in our lab, that homemade eye drops. We got the pH test done. It was lo behold, it was 10 and 11. Now the final diagnosis, hip hip hooray, we had was a chemical injury due to a deliberate tampering of the drops at home with an alkaline agent. And mystery was solved. The patient was cautioned, shifted to her brother's home from a son's home, and home nurse was appointed with a medication. And this was the plethora of the diagnosis we went through. And this she was on day 40. She was subjectively managed better. The discussion part here is these are the common household alkali like a baking soda, oven cleaner, or dishwashing powder or bleach which can be contaminated. The take-home message is, please think out of box when things don't fall in place. Keep revisiting and learn from your findings. And lastly, literature search didn't give any much results. These are the references for the E. coli. This was the workplace medical mystery which we sorted out. Thank you so much.
Thank you so much, ma'am. Very, very well presented.
This will make a very nice episode on Netflix or something like that.
डिटेक्टिव होना पड़ेगा सबको.
Thank you.